So I'm Dr. Nilesh Kumar, and I'm going to present my talk on how will the practice change in coming decades. So these are my financial disclosures. So there are four main domains that are going to change. That is the diseases that are going to change, the treatment, the diagnostics, and the patient that are having those diseases. That is going to change. But most of the change will happen only when we will change. So how are we going to change? We all are young ophthalmologists. We are going to be the future leaders. We are going to be the future consultants. So we have to stop thinking like the residents right now and start forming our own diagnostic algorithm, our own treatment protocols. Because in most of the medical colleges, still the old protocols are being followed. Long we have moved ahead from drcr.net, everything is individualized, but still it is being taught as that. So if we learn that after 10 years, when we start applying it, it is already outdated. So we have to change that thinking. That seems to be the voice of you. The award-winning essay by Dr. Pranesh says that we have to have a strong residency, and that is not going to change now. If we want to change, it won't change now. So when we are the leaders, we have to think like that. We have to start training our juniors like that. That will have a greater impact than anything else. And there is one existential crisis that we all think of when it comes for artificial intelligence, that is it going to make us obsolete? But we already are surrounded by it. The OCT perimetry, OCT printout, the perimetry printout, even the Facebook's friend suggestion, everything is artificial intelligence. It is only going to aid diagnostics. It is only going to make our life easier as to which patient we need to focus upon, which not. After that, the role is going to end, because artificial intelligence is never going to imitate two basic human tendencies, that is gut feeling and empathy. They might sympathize because they can be taught that if the patient is coming with diabetes, we can tell you have to say these words. The robot can say that, but they can never empathize. And those two feelings, the gut feeling and the empathy, that forms the the basis of the patient-doctor relationship. So we are not going to be obsolete. AI might make us a little lazy, that's it, not more than that. And how the patients are going to change. So the top 10% who don't mind the money and 20% who think that they need the treatment value for money, those two are being focused upon right now. But there is a bottom of pyramid, 70% patients who are not entering the hospital at all. The next wave, the next 2 decades are going to be focused on that, how to bring the needy from that. We can't bring everyone from that and get into the hospital. But from that, who is needy, that we have to do. So like smartphone assisted glaucoma screening, ROP screening, diabetic screening, here AI will play a role. They will do the screening for us, they will send the patient to us, and then we will be treating. So that is going to change. Apart from that, non-communicable diseases are going to change, become more frequent, because all the children now are having laptops for their homework, tablets for their homework. So dry eyes, refractive errors, glaucoma, everything is going to increase. Apart from that, AMD, cataract, they are going to stay. Apart from that, what we thought, like the carcinoma and all, which were in the upper strata diseases, they are now percolating down into the bottom of pyramid. So we need to have diagnostics as well as treatment ready for the patient who can't afford them. These treatments are not affordable right now with bottom of pyramid, but we have to have that, and that is going to change next. So diagnostic depends on which strata you are going to treat. If you are going to treat the top 30%, you can't skip. You have to have that state-of-art sophisticated treatment, diagnostics. But frugal and innovative is the way to go. These are the patented devices among the many from India. The MI RedCam, that is my Dix Pro, that is the patented smartphone device, and from LVPI Innovative Lab, the perimetry for infants. So why do you think India will be, I think that India will be the leader in frugal innovation is because there is a population that needs it, and the high cost of existing instruments. And apart from that, there is now a translational gap from the bedside to the clinics that is being bridged right now. Apart from that, the treatment domains are going to change. Right now, we have all these 4 domains: the preventive, the curative, the cosmetic, the maintenance. We are now going to be more preventive and more maintenance. And if we are going to be curative, it will have to have the cosmetic factor in it also. So how, the medical prevention of presbyopia, that is the most exciting development that is going to happen. It has entered phase 3 right now. So that is one of the most exciting things that we are going to prevent presbyopia, that is going to reduce the healthcare burden a lot. Apart from that, supplements are already being proven. Yoga, pranayam, cardiology, cardio exercises that have not been studied, but they have been proven in diabetes and hypertension that they help. Glaucoma and ARMD, they have the similar pathogenesis. So that has to be explored in next few decades. And I think that will be one more preventive factor that is going to come. Apart from that, coming to my area of interest, medical retina, biologics have played a major role in last 2 decades. They are going to continue playing a major role with brolucizumab already in approval, abicipar pecol already filed for FDA approval, faricimab and ranibizumab port delivery system already in advanced clinical trials. Apart from that, we are going to have biosimilars, and opthal remains the only place where LHON has approved gene therapy. RP and AMD, they are already on their way. They are in phase 2, phase 3 trials right now. So the opthal is going to be the hub of the biologics and gene therapy. But why India is going to be leader in ophthalmic biosimilars? Ophthalmic biosimilars are facing the similar resistance that low-cost IOL from Arvind faced. When they came out, nobody was going to believe in their quality. But now you can see it has brought down the cost drastically. Same is going to be in ophthalmic biosimilars. India again has a population. When you see the regulatory guidelines, it is immensely robust. It is immensely robust, except for Russia. Everywhere else, the guidelines are robust. Nobody can just get the approval like that. And when we have compared the efficacy and safety also, it has been proven that it is equally efficacious. And there is the only thing we need to fight is the nocebo effect. That is the negative placebo effect. The patient and the doctor both don't believe in the drug. Drug is not going to act. And then the last thing is how the hospital is going to change. The trend does, specifically the trend is towards group practice, but when you think of the patient still believe in solo practice. They feel that there is more connect to the doctors in solo practice than in, this is not only in India, it is also in USA. They have done a survey and proven that solo practitioner is more believed in. So wherever you go, the patient connect needs to be there. That is the main impact. And I will leave with this last slide. Publish or perish, that is a big question that comes every time. But I want to share a little story about my father, who started his residency. He came out with ICC in his kit. He could not afford fellowship at that time, so he didn't do. Once he could afford, he was denied because his age limit was there. So he learned ECC by himself. SICS, now he's doing around 3,000 FACO annually. Just by learning, he came, participated in each and every CME, workshop, conference he could, learned, went back, applied, and came back, learned more. So you might not publish and you won't perish, but if you are going to participate, you are definitely going to perish. Thank you.
Thank you, Dr. Nilesh, for your insightful talk.